Rotherham Hospice and hospices, adult hospice in general, that if you want some information, just pick up a phone and call us. Is that something that they can do with children's hospices as well?
I think if there are just so many conditions that children can have. You know, they can be metabolic, they can be related to the endocrine system, they could be neurological, respiratory, cardiac. You know, all of these words that I'm saying just sort of are related to different organs of the body. So all of the conditions we see can affect all different organs. And we're not the experts in all of those conditions. If you pick the phone up to ask us questions about those conditions, we'd probably have to sort of do a bit of research. And what I would advise families to do if they've got questions about conditions that their children have is to speak to the GP. If the child has got a lead, consult a paediatrician, speak to the paediatrician. And if a language barrier is preventing them from understanding this information, request an interpreter. Most healthcare organisations have access to interpreters. Sometimes we don't use them. We don't use them as much as we should, because sometimes we get by with body language and keywords, and it's not okay. We need to make much more of an effort to ensure that people are really understanding what we're saying, and also have that opportunity to ask all of the questions, because more often than not, your child is the most precious thing in the whole world.
Yes.
And we just want to know exactly what's going on, and we want to know what the future might look like, and we want to know what else might happen to my child, or what does this word mean, or does that mean that they can't go swimming, or are we okay to get a dog, what about their childhood vaccinations? And these are some really hard questions. These are really important questions to just try and get by with. So what I would say is identify a doctor or a specialist nurse or someone in a healthcare organisation that you trust.
I am going to have to interrupt you there because we're coming up to a break.
Okay.
So we'll continue this conversation after the break. See you soon.
You are listening to LinkFM 96.7.
ਰੈਮਿਟ ਚੁਆਇਸ ਦੇ ਨਾਲ ਸਿਰਫ ਪੈਸੇ ਨਹੀਂ, ਭੇਜੋ ਆਪਣਾ ਪਿਆਰ ਤੇ ਸਪੋਰਟ ਆਪਣੇ ਘਰ ਵਾਲਿਆਂ ਨੂੰ। ਹੁਣੇ ਰੈਮਿਟ ਚੁਆਇਸ ਦੇ ਐਪ ਨੂੰ ਡਾਊਨਲੋਡ ਕਰੋ ਤੇ ਸ਼ਾਮਿਲ ਹੋ ਜਾਓ ਰੈਮਿਟ ਚੁਆਇਸ ਦੇ ਪਰਿਵਾਰ ਵਿੱਚ।
Are you a taxi or private hire driver in Rotherham or Sheffield? Have you been involved in an accident? The claim team on Kimberworth Road, Rotherham is here to help you. We pay a £2,000 referral fee for non-fault taxi claims. Call us today on 0330 057 1009. That's 0330 057 1009. The claim team is here to help you get back on the road. Terms and conditions apply.
लो जी सुनो जी, आई गए खान कैटरिंग वाले। खान कैटरिंग राधरम, जिन्होंने मजेदार खाने ना कोई जवाब है नहीं, एक बारी आजमाई के तको। शादी ब्याह, सालगिरह, मानिया, मेहंदी और दिगर तकरीबात आस्ता इस महंगाई ने दौर विच सस्ता तो मजेदार खाना आर्डर पर बनवाई सकने हो। एक और भी गल बुझो, खान कैटरिंग राधरम वाले पूरे साउथ यॉर्कशायर विच कैटरिंग नी डिलीवरी भी करने। आर्डर निका हुआ या बड़ा, ऑलवेज वेलकम। खाने ने आर्डर वास्ते भाई इफ्तिखार की फोन करो या व्हाट्सएप पर राब्ता करो 07931737547।
हुसैन ब्रदर्स, हलाल मीट और ग्रोसरी का सबसे बेहतरीन मरकज। आइए और हुसैन ब्रदर्स की नई ऑफर से फायदा उठाएं। हुसैन ब्रदर्स, 6 ओलोलेन शेफील्ड, SA8GA। लोकल डिलीवरी के लिए अभी राब्ता करें 0114242089।
For over 30 years, Human Relief Foundation has been trusted with your zakah, delivering hope and transforming lives in the world's most vulnerable communities. From providing food to the hungry, clean water to the thirsty, and shelter to those in need, your donations make a real difference every single day. Choose the charity that shares your values. Visit hrf.org.uk today.
iTech Commercial Refrigeration and Air Conditioning. अगर आपको रेस्टोरेंट, टेक अवे, दुकानों और तमाम कमर्शियल फ्रिज, फ्रीजर, कोल्ड रूम और एयर कंडीशन की सर्विस और रिपेयरिंग की जरूरत है तो iTech कमर्शियल रेफ्रिजरेशन एंड एयर कंडीशनिंग की तजुर्बाकार टीम आपके लिए हाजिर है। iTech कमर्शियल रेफ्रिजरेशन एंड एयर कंडीशनिंग। कॉन्टेक्ट नंबर 07955198814 and 07955198824.
My name is Shireen. My name is Abed Rahman.
My name is Saim Mudassir.
This is Rohan.
My name is Rizwan Ishaq.
My name is Asham.
My name is Azan Mudassir.
This is Ariba and you are listening to LinkFM.
Anywhere you go, LinkFM is always there with you. Listen online at linkfm.org. LinkFM.
दिलबर मेरे कब तक मुझे ऐसे ही तड़पाओगे मैं आग दिल में लगा दूंगा वो कि पल में पिघल जाओगे दिलबर मेरे कब तक मुझे ऐसे ही तड़पाओगे मैं आग दिल में लगा दूंगा वो
Assalamu alaikum. Hello and welcome back to Care Across Cultures on Link FM 96.7. You're listening to me, Mirban Hussain, your host, and my wonderful guests today, Eve and Zoe from Bluebell Wood Children's Hospice. We've been talking about children's hospices, how they're different from adult hospices. We've been talking about one of the differences that children tend to have more sort of life-limiting illnesses rather than cancer, although you know there are some that do have cancer. I'm going to go back to my guest now and ask them a very personal question. And the question I'm going to ask both of you, and if I can start with Zoe first.
Yeah.
What made you choose this line of work?
Okay, thank you. So I actually came into nursing fairly late into my working career. In my mid-30s I finished my nurse training, so I worked within the NHS on the wards for a while, and although I loved that job, I felt like it just wasn't quite the right path for me, and I wanted something where I could be this is a buzzword that's used a lot, but I wanted to provide more holistic care. I wanted to know that I could provide the full care for a family unit that it needed in a particular circumstance. Where I worked before, children were approaching the end of their life, and while the care was good, you could see the gaps that were there. I felt like there was more that I could do. So an opportunity came up at the hospice, and I thought this is a big leap for me to come out of the safety and comfort of the NHS, but it felt like the right one. And I've been there at the hospice now for over 3.5 years, and in the clinical nurse specialist role for about 2.5 years, and I love it because it just means that I can offer real high quality care and support and say yes to things for these families that they really desperately need in time that they really, really need it. It's a privilege.
Thank you so much. Zoe, the same question to you, but before you answer, was it this weekend that you did a 10k run for Bluebell Wood Hospice?
Yes,
1 hour and how many seconds?
An hour and 2 seconds. I was very upset with those 2 seconds. But yeah, it was a great day, yeah. And actually it just kind of highlighted to me how challenging it is to raise money. I worked out before I did the run, I thought it would take me about an hour, and to keep the hospice open for an hour it costs about £742, and I've managed to raise 300, which isn't even half an hour of hospice care. So there's yeah, I think I've got a lot more. Well, you've done
half an hour.
I've got a lot more miles in my legs to go to make a big contribution. So yeah.
So that's, you know, I'm always amazed by staff at hospices who not only work there, but they go out and do this other wonderful fundraising stuff.
I've done it as well.
You've done it as well, yeah.
Yeah.
So, what made you come to hospice work, especially children's hospice?
So I also didn't train as a nurse straight away. When I left school, I studied psychology, and I was living in Surrey and doing a master's in health psychology at the time, and I got a part-time job to fund my studies, and I worked as a nanny for a little girl called Laura, who had a brain injury from being in a car accident. So she lived with her dad, and she had four nannies full-time who provided all of her care. And Laura got a chest infection. So a lot of children, when we talk about comorbidities, a lot of children who can't move themselves very well, use wheelchairs, can't sort of roll or sit up or walk, they have very vulnerable chests, so very vulnerable to chest infections. And she got a chest infection and went into hospital. She then went to intensive care. She went back to a local hospital, to a general ward, deteriorated again and went back to intensive care. And this sort of to-in and fro-in between the general children's ward and intensive care lasted for about 4 months, and in the end her dad made the decision that we would bring her home, where we knew that she would eventually die. And so Laura came home for 4 days, and she died at home. So she was surrounded by all of the nannies, but during that whole 4 months, it's one of the hardest times of my whole life. You know, it was an awful experience, but there was some really incredible nurses. You know, the intensive care nurses, the nurses on the ward were just fantastic. But in that whole time, there was only one person who ever asked me if I was okay, because I was just the nanny. And so, like Zoe said before, you really see those gaps when you see things from a different point of view. And so I decided to retrain as a nurse, and always wanted to then come into palliative care, so that I felt like I was able to address some of those gaps. And so when I've worked in the NHS for my whole career, until last year when I saw the job at Bluebell Wood. And one of the reasons I went for the job was because on the job advert it listed all of the services that the hospice provides, and the family support services were huge. And I think that is so important. Like we said earlier on, we've got a really precious child in the middle of all of this, but they're part of a family unit. So we've got to provide care to everybody and recognise everybody who's important in that child's life.
So I mean, I'm glad you said mentioned services. So what kind of services do Bluebell Wood provide, and do other hospices, children's hospices across the country provide the same or similar?
Yeah, so the services that we provide, we actually provide some planned care for children. So we call it short breaks. You might know it as respite. So children can come into the hospice for 3 or 4 nights for a short break, do lots of lovely activities, and the family can come with them, family can stay at home, family can go away for a few nights if they want to. And we just try and make that a really fun stay for children. So we might plan days out. You know, we've got some really brilliant local places who give us tickets for the children. So there's a butterfly farm nearby.
Yes.
You know, we get some things from, lots of organisations give us passes so that we can take the children out. And families and siblings and whoever wants to go on those trips. Sometimes if children aren't well enough to go out on trips, we bring the trips to them. So a few weeks ago we had a beach created in the garden of Bluebell Wood. We've got a huge garden. We had one of our teams got a pony, so she brought a pony dressed up as a mermaid. We had an ice cream van and a paddling pool. So we create really special magical memories. we'll do symptom management, so Zoe's team will lead on symptom management days. So if we've got a child or a young person who's out in the community who are really struggling with some symptoms, whether that's pain or they're really struggling to sleep for some reason and we can't quite unpick what that is, it could be that they're feeling agitated, they're feeling anxious. We can, for any of these symptoms, the list is endless, we can bring children in for a symptom management stay, which helps parents to sleep and recharge their batteries a little bit, while we've got some really skilled nurses who can keep an eye on those children and monitor what's happening and try some different things and see if we can get on top of those symptoms. We provide end-of-life care, so if we think that a child is in their last days of life, then and if the family want to come into the hospice, we can bring them into the hospice. We can support them at home if they want to stay at home. If a family are in hospital and that's where they choose to stay with their child, we can support the hospital team as well. So we're trying, our mission for the next 3 years is to try to provide the same level of care wherever that family choose to be or wherever that child or young person wants to be. We provide care after death, so if a child dies in the hospice or in the community, we have some bereavement bedrooms either end of the hospice. So we've got Primrose at one end and we've got Forget-Me-Not at the other end, and we've got children's bedrooms within those. They're almost like self-contained flats with a kitchen and a parent's bedroom, sofa beds and a living area, but they've got a children's bedroom that can cool right down. So after a child has died, or a baby or a young person, we can put them in those bedrooms and cool it right down so that we can preserve the body for a bit longer and give the family a little bit more time to say their goodbyes and make plans without them having to go to a mortuary. And we can do that, whether that's somebody who's having a funeral in 2 weeks, or if they're having a funeral the next day, if they're having a rapid burial, if they haven't managed to get that funeral in before sunset and it's going to be the next day, we can support that in the hospice.
Okay, thank you so much for that.
Yeah.
Sorry.
No, so I was going to talk about family support services, but if you've got a question.
No, okay. The question I've got is that we're talking about sort of cultural sensitivity and cultural care, and we're talking about we have such a diverse community within the UK. You mentioned end of life, and you mentioned death and what happens after bereavement, and one of the things that I want to just sort of touch on is that how do you support families with different religions and different cultures at bereavement and end-of-life care?
We absolutely accept that we are never going to be able to know everything about every culture, every religion, every family. So what we try to do is we try to ensure that our staff are curious and ask questions and are open to hearing what families need and knowing the right questions to ask so that families feel comfortable in telling us what they need. I know that 2 Christian families won't want the same thing around the time of death. 2 Muslim families won't want the same thing around the time of death. People who don't follow a particular religion will have different needs around the time of death. So we try our very best to make people feel comfortable enough to have a conversation with us and say, I'd really like to bring my imam in, is that okay? And it absolutely is okay. And equally, if they're sort of really far away from their local community, if they've come from Lincolnshire, we will also we will support to identify somebody more local who can come in, to help that family. We do some training, Mervan, because you've delivered some training to some of our staff. We try to learn about different religions and different cultures and different spiritual needs so that we can ask the right questions. I was there when in a different job, in a previous life, in a different job, when a baby was taking her last breaths, and I was with a Muslim nurse, and she said something to the family in Urdu, and I said to her a bit later, would you mind me asking what you said? And she said to Mum, do you have any Zamzam water? And so we we pick up things along the way, and we just do our very best to get to know families, and that's why we'd rather have early referrals so that we can have these conversations before. We use the advanced care
When you say
plans.
the care planning is a huge part of this, because we can have these conversations early, and then if there's plans that need to be put in place, if there's things we need to consider, we've got that information to hand, so we can.
So I think Zamzam water is a good example, because there are so many, little things that we don't know about.
Yeah.
There's holy water, for Christians from Lords, and there's so many. But the key thing that I picked up from you is that personalised care.
Yeah, absolutely.
I wanted to do the best that we. And I really love the bit about motivating your staff to be curious, and asking those questions, which feeds directly into the advanced care plan. Okay, so now one of the next question I do want to ask you is that, are there any steps that you're taking to reach communities that might be underrepresented within within this area?
So we have recently created an equality, diversity and inclusion group at the hospice to make sure that we can build a strategy to look at how we reach those people that we're not reaching at the moment, because we know that when we look at our caseload, we know that doesn't match the population of children with life-limiting conditions in the area that we serve. And Together for Short Lives, the website, the organisation that Zoe mentioned earlier, they've produced some data around different communities who have higher incidences, higher numbers of children with life-limiting conditions, and so we're using that data at the moment to make a plan, to build a strategy. So we know our caseload has lots of white British children on it. We know that our caseload should have more Pakistani children on, because we've looked at the data and we know that there are high instances of life-limiting conditions in the Pakistani population. In some black communities as well, we know that we should have more black families on our caseload. So what we're doing at the moment is having a look to see what does our data look like now and what does it need to look like soon. And I say soon because it's not in the future. We need to do this really quickly. And so at the moment we're just in the planning stages of identifying the groups that we need to target first. And that's, different ethnicities, but also looking at the data around what are the life-limiting conditions in children, and a lot of that, like Zoe said earlier, is congenital, so it's genetic. It's those things that's either a spontaneous mutation or it's something that's hereditary. We know that respiratory conditions, there's a lot of respiratory conditions that are life-limiting, neurological conditions, and there's also lots around the neonatal period, so babies. There's lots of, there are not lots luckily, but there are babies under 28 days old who sort of make up a lot of the childhood deaths. So there's lots of work that we're doing to make sure that the caseload that we've got at Bluebell Ward, the families that we're supporting, are representative of those who actually need us.
Fantastic, thank you so much. Just to pick up on your EDI strategy that you're looking at, I'm also looking at an EDI strategy for Rotherham Hospice. So I think maybe we could sort of, out of this, have a chat about that.
That would be great, yes. And congratulations on your new role, Mervan, as EDI lead. Yes, well done.
Thank you so much. Okay, now Zoe, I'm wanting to ask you, what would every parent listening today want to know about children's hospice care?
Ooh, what would they want to know? That's a good one. I think that they would want to know that children's hospice care is something really safe for their families. And what I mean by that is, if you are ever in a position where you're offered hospice care or palliative care, it's that addition, it's that add-on, it's that gap-filling care that your statutory services can't currently provide. So going back to the cloak, we are the cloak around the rest of the care that your child and your family will receive. So that's what I would like them to know, I think. Yeah.
So with your permission, I'm going to take that cloak, because I love that.
Yeah.
I've heard so many different explanations of palliative care. I think that's the best one so far.
Of course.
And I think I just want to sort of mention this reiterate it to my listeners. So अभी जो है ना जोई कह रही थी कि ये क्या है palliative care क्या है, इसने बहुत अच्छा जो है ना एग्जांपल दिया. कहती है कि जैसे कुछ चादर होती है ना जो आप बिछाते हैं सबके ऊपर, a cloak, and I think that's one of the best ways of describing this. So chadar is like it's like a big hug, isn't it? Yeah, and I really love that.
It's definitely a snuggly, warm, kind cloak.
Yes.
Yeah, definitely.
And I've been to Bluebell Hospice, and it is an amazing place. I would suggest to my listeners that there are a few things that I really, really want to talk about. One is that children's hospices provide amazing care, not just for your child but for the whole family. And they can't provide that care without funding. So if I've got some millionaires listening out there, because I'm sure we have, maybe you've got a spare 5 million that you can donate to Bluebell Wood Children's Hospice. All you have to do is just get in touch, yeah? And I'm sure they'll take that money from you.
We're very grateful. Yeah.
But, you know, even if, you know, you've got £1 that you want to give, yeah? Even if, you know, you want to do a cake, bake sale, anything, any sort of fundraising activity, please get in touch. And because the service that the Children's Hospital provide is absolutely amazing. And it's not just Bluebell Wood. As Eve said earlier, 54 children's hospices across the country. So you will have one near where you live. And go and find out. And go and volunteer. Because they need volunteers as well. So we are coming to the end of the programme very soon. So if you've just tuned in, you are listening to Care Across Cultures on LinkFM 96.7 with me, your host, Mirman Hussain. And we've been talking to Eve and Zoe from Bluebell Wood Children's Hospital. Now, I'm going to go back to my guests. So this is we've been talking about money. How do you support families who are struggling financially with additional costs? Is that something that you do?
So we have a family support team with lots of different services provided by that team, and we've got some really skilled members of that team who know how to support families through things like the benefits process. So let's make sure that you're getting all of the benefits that you're entitled to, because when you've got a child who has a really complex health condition or a life-limiting condition, quite often the care needs of that child, the demands of looking after one of those children, a child, you know, who maybe doesn't sleep, who has lots of medicines, who has lots and lots and lots of hospital appointments in all different places. You know, it's really hard to have a full-time job. It's hard to have a part-time job. And you've got the costs of things like parking at hospitals, you know, buying food in hospital if you've got to go for an overnight stay. You know, financially, it's a really, really challenging thing. And so we like to support families. We don't have the money to give families. We absolutely would if we could. But what we will do is we will make sure that they know all of the benefits that they're entitled to. If they need support to fill out those forms, we'll try to provide that support as well. Going back to your question earlier about sort of literacy and being able to, you know, fill in these forms that are in one language, you know, we do have a team who will help to do that. And we also sort of go in above and beyond the benefit side of things. We have within our family support team people who will apply for wishes and grants. So if your child really loves the outdoors but you've got a garden that's really overgrown with no time to fix it, you know, we can apply for wishes to have that, you know, a garden makeover or a grant to have an extension on the house. So we don't have money to give families, but we will absolutely support families to try and find other sources of income to support them.
That's amazing, thank you. Zoe, I want to ask you now, what message would you give families who might be hesitant to ask for help?
I think if you were a family that were hesitant to ask for help, because there is an awful lot of stigma around the word hospice, I think if you are in a position where you might need to consider hospice care for a child that is part of your family, to reach out to that hospice and see if you can just come and have a look. It can be a very informal thing, with no more commitment than just coming through the door and maybe having a cup of tea and a wander around the garden and then take it from there, you know. I think sometimes just seeing the hospice can take down some of those barriers and worries.
Because it is a very welcoming place. I mean, it's a beautiful, I know it's in the middle of nowhere, but once you get there, it's a beautiful place, isn't it?
It's in a lovely setting, actually. It feels like you're in the middle of nowhere. We've got a lovely driveway that you drive down with bunny rabbits hopping around, but it's only 5 minutes off the M1.
Yeah.
So it's easy to access. It just feels like you're kind of out in a lovely rural setting. Yeah.
Yes, it does. The same question to you now, Eve. What message would you give to families, or what final message would you like to give to our listeners?
I think probably reiterating what Zoe said earlier about, you know, when you hear the word hospice or you hear the word palliative, you know, it's not a word anyone ever wants to hear associated with their child, with anyone that you love, but especially a precious child. And I think what people often hear when we say those words is that we're taking something away, we're giving up, we're not going to treat. And actually what we mean by palliative care or hospice care is that we want to give you more care. We want to wrap that cloak around you. We want to care for your family as well. And so actually when you hear those words, it's because we want to plug those gaps. We want to enhance care because we know that this could be the most awful thing that anybody is ever going to go through. So we want to care for you more.
And that's brought us neatly to the end of the programme. Thank you so much for that. You've been listening to Zoe and Eve from Bluebell Children's Wood Hospice today. We will be back next week with someone else from Children's Hospices, hopefully, fingers crossed. Thank you for listening. Allah Hafiz and goodbye.
Listen to Link FM on the move by downloading the Link FM app.
If you would like to promote your business on Link FM, our team can help you. Contact us on 0114 261 8182 or email us on info@linkfm.org.
Do you want to make a difference in your community?